When you or a loved one are trying to look for care, it's super common to ask the question, not just what do I need, but you might start hearing the term home care. Well, today we're going to be answering the question, what exactly is home care and how does it differ from other types of care in the industry?
Hi guys, Amber here again with Select Home Care.
And Bryce Hayes, director and owner.
Yeah. So we have another great question that is actually something that we don't get asked a lot, but we think it's actually a very important subject that we just explained to you guys to most likely start your journey.
Yeah.
So this week's question is, what is home care?
So for folks that are just kind of figuring out, mom or dad, or even a spouse or yourself, I need some help, but what kind of help do I actually need? Today, we're specifically focusing in on that from a perspective of what is in what we call the continuum of care and what is home care within that and how do we play into kind of that bigger picture.
Yeah, absolutely. So we, a lot of times is, do I even need home care?
Yeah.
Yeah, because they don't understand what we actually do. I'll frame out the framework. So home care is non-medical in-home care. That's something that we try to specify as often as possible because there is medical home care and non-medical. So we are on the non-medical side.
Yeah, and medical home care is most often referred to as home health. And so we get, everybody gets mixed up with it pretty often, right? Even just in names of different companies, right? Oftentimes they'll have a home care when it's more on the home health side. So that distinction, right? Medical versus non-medical can be a really big deal. And that home health focuses on rehabilitating and working with families to, again, rehabilitate and improve acute conditions. Meaning, I've broken my foot or I have an open wound and I need to get better, versus home care is really a long-term care solution, right? It's about finding how you operate within what may be your new normal.
Yeah, absolutely. So what we do is during our assessments, we come through and we try to find the pain points or maybe the struggles you're having with daily activities in your life. So we are going to go through a spectrum of, do you need help bathing? Do you need help getting up from a seated position, transferring to different furniture or from a standing position? Anywhere from, do you need help prepping or eating meals? Do you need help with light housekeeping, which we did a video on?
Yeah.
What is light housekeeping? And then, we also are going to help you with other daily tasks as pet care. If you're struggling physically, and not being able to take care of your pet, normal things, we're going to try to help with that. So, home care is trying to improve your quality of life in your home with those daily tasks that once you were independent doing.
Yeah, really the hope of home care is that if you're deciding between can I stay in my home or do I need to go to something like an assisted living, the idea is that if you can prolong the amount of time you can stay in your home, for a lot of people that's really attractive, and in many cases it can actually be done for cheaper than going into an assisted living, especially if your needs are not that great. There are some situations where the needs are extreme and assisted living or even a skilled nursing setting is most appropriate, but typically, especially if you're just starting to slow down, again, like you're talking about with pets, right? Fido is my best friend and provides me so much comfort, but my goodness, bending down to to feed him or to give him some water, I just I've thrown out my back 3 times, right? Those sort of things. That's a great place that somebody can come in. And I think the most underrated piece that we didn't even mention is that it's also a companion, right? You
need a friend.
Yeah, sometimes you get in that feedback loop of like, I've told all my stories to all the kids and all the grandkids, so it's somebody new to tell stories to, but also somebody new to experience, and somebody that's also experienced in the aging process that can help you make sense of what can often be a very scary and difficult time.
Yeah, and our caregivers are trained and experienced to follow from possibly starting in a companionship role with you. And as your needs change and your difficulties increase, that caregiver can follow that progression with you and help you through those. So it honestly becomes, there's a lot of bonding, I think, with a caregiver
Absolutely.
and their in-home patient, because one, we're in your home, your safe space, your area. So, we come in and we're going to try to build that trust with you, and, help you with those daily tasks. We want to make your life easier.
Yeah, exactly. So my question for you guys is going to simply be, have you ever had help brought into your home? So that could be something like home care, it could be something like home health, even if you have a family member that's had hospice before. Tell me about your experience that you had with somebody in your home or in a family member's home, and we will talk about it next time. Thank you, guys.
Yeah, thanks, guys.